Now, this is a story about a 52-year-old man living with cystic fibrosis. He's a member of a group, a Nova Scotia Advocacy Committee, that is committed to getting this new miracle drug approved here in Canada. And we welcome to the show this afternoon Tim Vallillee. Hi, Tim.
Hello, Sheldon. How are you?
I'm very well. What is it like living with cystic fibrosis, first of all?
It's exhausting, to tell you the truth. I'm actually really one of the, I could talk to you all day about this subject. I'm really one of the very lucky people in Nova Scotia in the CF world because 6.5 years ago now, I count every month I can get.
Yeah,
6.5 years ago, I was really quite blessed to get the very first gene modulating drug available for cystics called Kalydeco. And it completely changed my life. I was dipping down to the low 30s for my lung function, and after only a very few number of weeks, my lung function jumped to 52. So basically, what this drug does, it goes in on a genetic level and basically rebuilds you. And so I've been able to really live and thrive and breathe for the first time in a very long time, and to be able to feel fairly quote unquote normal. It's quite the discovery. And now there is a new drug called Trikafta. And to give you comparisons, the drug I'm on only helps 3% of the CF population. And when this new drug was discovered, it actually helps 90% of our CF community, and it actually works, to my understanding, much better than what I'm even on. So we are really, really hoping to get it into Canada, and we've been actually fighting for over a year to get it approved in Canada, where so many other countries around the world, when it first hit the market, it was accepted, paid for, and into people with CF, and they have been thriving. Sadly, in Nova Scotia, in Canada, it hasn't come across the border yet.
Right.
And it's incredibly frustrating.
Tim Vallillee is here with us. I ran across a story out of Charlottetown, a young man who joined a group called CF Get Loud Canada, again pushing for access to this medication that's been described as life-changing. Do we know what the holdup is, why Trikafta has not been approved for use in Canada?
Absolutely. Well, first of all, it is a pretty expensive drug. Like, for example, Kalydeco, the drug I'm on, the price tag originally was around $350,000 per person. So that's astronomical, I understand. So these drugs are not cheap. They are gene modulating drugs, and like I said, it's not just throwing Tylenol on a headache. It actually goes in and changes the genetic code. So these drugs are expensive, but there are so many review boards in Canada to get any drug approved in Canada. It's quite a circus, and the system's really quite broken. We first have to get through Health Canada. Health Canada has to approve this thing, and then the drug has to go through another review board called the PMPRB, which stands for the Patented Medicine Price Review Board, and they really try to negotiate a price with the drug company, they're called Vertex, and they're out of Massachusetts. So that's actually where we've been stuck for a year, is getting. It's such a complicated process, but so there's that board. Then after it goes past the PMPRB, it has to go through another board, which is called CADTH, which is the Canadian Agency for Drug Technologies in Health, and they battle back and forth with Health Canada to make sure that it's something that is worth doing. Then after that, it goes through another review board called the PCPA, which is the Pan-Canadian Pharmaceutical Alliance, and they really deal with trying to get as many rebates down. It's kind of like selling a car.
Right.
Try to get as many rebates as possible to get the best price at the end of the day. And so we have to get through all those review boards before a drug's even accepted. But we are stuck on the second level right now. It's been over a year, and that's where I feel like we are really this system is so broken. And meanwhile, people are dying. We've lost a beautiful young Nova Scotian in Truro back in February, who, if she had got this drug into her system, she would still be with us today. And just last week, we lost another young man in Yarmouth named Ryan Saunier. And if he got this drug into his body, a year ago, he would still be with us today. And this is where the frustration really builds, because we have been working so hard to wake up our government. Our health minister federally is playing a very nasty game of blaming the drug company for not even presenting Trikafta to Canada, and it's 100% not true. They've tried 3 times, and it seems like it all comes down to dollars, and I totally get that. These drugs are expensive to create. They're expensive to get into the country. But my personal feeling is, if we can bail out our whole country for $100 billion because of COVID, why can we not find a way to help? There's only 4,500 cystics in Canada, and if you really do the math, it's expensive, but it's very it's minimal compared to what the government has poured out.
Well,
and also the other.
Yeah, I was going to say, just what price do you put on a human life?
Exactly.
It's a long and winding road to get there, and I know government has talked about a national pharmacare plan or some form of this. Obviously, drug companies or private insurance companies aren't covering this either. Even if it was available in Canada, they probably wouldn't cover it. That's my guess.
Well, I believe there are a couple of. No, I can only talk about Kalydeco, the drug I was on. There were a few insurance companies that did cover it, but yeah, it's very, very few, because it is incredibly expensive. So we're trying to figure out how we can get this to work.
Right.
And I also like to compare the numbers of the cost that it takes over the lifetime of somebody with CF from regular clinics. We pay for our doctors, our nurses, our whole clinic staff across this country. And we have to pay for anytime there's, the medications that we're on for our whole life. Then we have to pay for any admissions in the hospital. And then, God forbid, you have to go for a lung transplant. Well, do that times 4,500 people. It's pretty darn expensive. And we actually did a cost analysis, and the numbers are actually fairly close. So if we still have to pay for all of our medical care, why not pay for one drug that pretty much covers almost the whole CF population, and gives us that quality of life and a normal sense, a normal lifetime. Mm-hmm. I'm 52. My lung function, even though I'm on Kalydeco, is the mid to high 40 percentile, which is not really where I want it to be, but it's a lot better than 31%. But the whole idea is to get these drugs into young people so they don't have a lifetime of lung damage and abdominal damage, which is what cystic fibrosis does. And it eventually cuts off our air, and we're done. And we're at an age now, it's a very, I'm very angry about the system right now, but we're in such an amazing, positive time in cystic fibrosis. The CF Canada has been around for over 50 years. And in 50 years, wow, we have come a huge way with all the fundraising that we have done. I remember doing rockathons, rocking a rocking chair as a kid. Yeah. Probably my first memory of raising money for CF. And, we have a national walk that we do. There's been countless fundraisers and millions of dollars raised for these exact medications, and we're finally there. So why can't we have that carrot? It's like it's being dangled in front of our face, and we cannot get it.
All right.
And that's heartbreaking.
It is. Well, Tim, we will certainly keep this conversation going. I want to thank you for bringing it to our attention. And quickly, if you can, just tell us how we can help you.
You know what you can do is you can rattle the chain of any political party you can write letters to the Patty Hajdu is our federal health minister. Direct a letter directly to her of how you want this drug in Canada and to stop wasting time on it. People are absolutely dying, and we are sick and tired of it. So make some noise. Get a hold of Randy Delory, our provincial health minister. He can't really do much until it's passed federally, but you can certainly. He knows all about this. Believe me. So anyone any political person whether they are in the health field or not, please just start rattling chains, and please help me save the rest of these folks that are looking for this next amazing medication for cystic fibrosis.
Tim Vallillee, thank you, sir, and good luck, and really glad you reached out.
Thank you, Sheldon. I super appreciate it. We'll be talking.
We will, absolutely. Tim Vallillee is his name. He's a 52-year-old man saying this drug can help up to 90% of the people with cystic fibrosis. He said it's expensive. I did a quick look here, and it's about $400,000 Canadian a year.